My name's Mark Swift. I've worked in the health and care system for nearly 15 years now. So Wellbeing Enterprises was one of the first health and wellbeing community interest companies to set up in the UK back in 2006. We have a special interest in what's being called community-centred approaches to health. So how do we leverage people power and the assets of our community? We provide services, for example, like social prescribing, so providing non-medical prescriptions, prescriptions for confidence classes, life skills training, chances to meet new people and learn new skills, have fun and feel good. Our strategy and our tactic has been to engage in courageous conversations with leaders in the health and care system. And to say, if we were to reimagine health services so that they're fit for the 21st century, what would need to change? And what role would our wider stakeholders play to ensure that those services are delivering the kind of outcomes that the people we serve deserve? That's our strategy, if you like, to engage in courageous conversations, develop social models of health, and deliver services like social prescribing, like volunteering, community navigation, where we connect patients to wider base support that's available in the community. And we found that when we do that, we are delivering outcomes that are often on a par, if not exceed, clinical treatments. But actually, by working with our clinical colleagues, we're able to augment those outcomes. So there is a place for medicine responding to medical issues, but there is also a place for a social paradigm of health where we recognise that the root causes of those concerns lie in the social. So we work very closely with colleagues in health, social care, and with our partners in the voluntary sector to ensure that we can target our resources at those in greatest need. So we look at what our health intelligence, our data tells us about where these people are, what their needs are. We then go into those communities, we build relationships with people, we get to understand what their lived experiences are like and what the barriers are to being able to live a healthier life. And then we finally work with our clinicians and our health colleagues as well, those individuals working on the front line. And by bringing those three insights together, the conversations with communities, our data and our intelligence, and the wisdom and knowledge from our health and care professionals, that gives a very powerful lens through which we can focus our resources to ensure we're reaching out to those people who are in the most need. And that's really important when resources are stretched.